This is Chris Marshall. I'm a physical therapist with Bay State Physical Therapy. We're here at the Powerhouse Gym in Cedarville in South Plymouth, home of our Cedarville office. And this segment is to cover stretching techniques and exercises. It's always important that you contact your doctor or physical therapist before starting an exercise program to make sure that it's safe for you. The first thing I want to do is just talk a little bit about the philosophy of stretching, why I instruct my patients to do it the particular way that I do. It can be very confusing. Over the years, I've heard many different types and techniques for stretching, and sometimes it can be confusing even to the professionals. One of the things that helped me many years ago was I read a book by a couple called with the last name of Anderson, and that book really helped me to understand the purpose behind stretching and some different techniques that work very well. It's important that you be nice and relaxed when you're stretching. So one of the things I want to teach you is a way to relax using your diaphragm to do the work of breathing. When you breathe in, it requires mechanical work to bring the air into your lungs. And when you exhale, breathe out, it's really a relaxation of your body. There's two different mechanisms that you can use to bring air into your lungs. When we're born, we use our diaphragm muscle, which is a muscle at the base of the ribs. And when that muscle pushes down, it pulls air and draws it into your lungs. When the muscle pushes, it pushes the abdominal contents of your stomach and so forth up. So when you breathe in using your diaphragm, you'll see your stomach rise. As you relax, the air goes out. The other mechanism that you can use is your neck and your shoulder and your chest muscles to lift your rib cage up to get the air in. It's a more shallow breathing technique. And it requires a lot more work. So it's good to practice using your diaphragm. It's much more energy efficient, and it helps to draw air deep down into the bases of your lungs. So as you breathe in slowly, you should feel your stomach rise. And really your chest should stay relaxed. So if you put one hand on your stomach and one hand on your chest, as you breathe in, you should feel the hand on your stomach moving, but your chest should stay relatively relaxed. You shouldn't feel much movement there. It's a little bit easier to learn how to do this technique laying down than sitting up, but you can learn to do that. Once you practice this and you learn to use how to control that muscle, you should be able to do it in any position. Like I said, it's important to be relaxed when you do your stretching, and it's important that when you feel it, it's not painful. You should feel a gentle pull, and I want you to learn to hold that stretch until the pulling goes away. I'm going to go through some basic stretches for back, legs, and arms today, and just to have you practice and learn the technique. One of the exercises your therapist or doctor may instruct for you to do is called the knee to chest stretch. And if you grab underneath your knee so that you don't put pressure on the kneecap itself and the joint, you can hold that stretch until you feel a little bit of a pull, and then hopefully after a few minutes it will go away. Again, it should be pain-free. Practice your diaphragmatic breathing while you're doing your stretching. It'll help your body to relax. Allow that stretch to occur. Be patient with your stretching. Some muscles, if they're very tight, might take perhaps 3 or 4 minutes to relax and really stretch properly. Another stretch that you may be taught is a lower rotation stretch. Again, this would be for your hips or for your lower back. Remember to always move slowly. Take your time. If you're Your therapist or doctor may recommend that you get into a position that allows your lower back to arch. Helps to maintain good lordosis in your lumbar spine. In this position, it's important that you make sure that your hips stay down flat against the table. You should bring yourself up onto your elbows or even press up to a point where you feel a stretch in your lower back. It should not be painful. Again, you try to hold that position with your hips flat on the table. And try to hold until that pulling goes away. Next, we wanted to cover some basic stretches for your leg muscles. And it's good to try to have at least one stretch for each major muscle group. Right now, we're going to start with the hamstring. The hamstring is the muscle that runs up the back of the leg, back of the thigh, runs from the back of your knee right up, attaches right up underneath your buttocks. Lots of different ways to stretch your hamstrings. Just happens to be the way that I prefer. I like this technique because it helps support the entire leg, and the back of the knee isn't hanging in the air and there isn't a lot of stress through the joint. You can really relax in this position. That's important. You want to be in a position that when you're stretching you can relax. Again, position yourself where you feel a gentle pull in the muscle. Try to hold that position until the pulling goes away. It should not be painful. Once one side stretches, switch. The same thing on the other. The other muscle we want to stretch is the groin muscle, the inside of the thigh. I like to have you stretch by putting your leg on something and keeping your toes and feet pointed straight ahead. This should give you a stretch right along the inside of the thigh. You'll find that if you tilt your back one way or the other, it will increase or decrease the pull on that. And you can use that movement if you need to make slight adjustments in the stretch. Again, looking for more of a gentle pull and allowing it to go away. You can do the same thing on the other leg. Always recommend starting off on a little bit lower surface and gradually working your way up. The other major muscle in your leg is your quadricep muscle in the front of your thigh. It's important when you're doing a quadricep stretch that you keep your body up straight. You want your hips straight. Try not to lean forward. Keep yourself up straight. Bring your knee back to where you can feel a gentle pull in the front of the thigh. Again, be patient with it. It should not be painful. Just take your time. Allow that muscle to stretch and loosen. When that's done, do the other side. Last major group in the leg is your calf muscle. The way that I prefer is if you find something that's approximately 1 inch to 2 inches high, this piece of foam or even a little piece of 2x4 works good. If you put your toes on it and you keep your heels flat on the floor, you should feel a pull in the back of the leg, lower leg, right in the calf. Again, be patient with it. Allow that pulling to subside. Your calf is made up of 2 muscles. One of the muscles crosses the back of your knee. If you bend your knee slightly, it will put that muscle on slack, and allow the other muscles to stretch. You'll feel that a little lower, down more towards the heel by the Achilles tendon. Same way, hold it, allow it to stretch, give it time. I was just going to cover a couple of basic arm and neck stretches. To stretch out your wrists, your prayer stretch works well. Get the underneath of the forearm. Just hold in this position. You can tilt your hands back and forth if you need to get a little stronger stretch. To get the top of the forearm coming down this way. Stretch the tricep muscle. Bend your elbow, bring it back, and hold for a few minutes. Again, it should be a gentle stretch, no pain. You're going to hold till the pull eases. Important to be patient with your stretching. good to stretch your pectoral muscles and your biceps out. You can grab a hold of a door frame or pole, move your body away. You should feel it pull across the front. Nice and gentle, pain-free. Hold until the pull goes away. You can reverse and do the other side. Last is a neck stretch to stretch your upper trapezius muscles that run up the back on either side. If you gently tilt your head to the side, you should feel a pull that runs from your neck down to the top of your shoulder. When coming out of this stretch, I like to raise the shoulder before lifting the head. Same on the other side. That concludes our stretching program. Thanks for watching. Have a good day.